Okay, so I took a month-long vacation. And of course, it's perfectly justified in these words of mine. Na laissez pas la vie s'empérer trop de vous, libérez-vous, trouvez la paix et des idées méditatives, voyagez dans les montagnes et les rivières, rien n'est un milieu trésor à chérir. It means, let not life catch hold too much of you. Liberate or release yourself, find peace and meditative insights. Travel to mountains and rivers. Nothing is a better treasure to cherish. Welcome all to IS Pharmacology Difficult Podcast. I'm your host Dr. Radhika Vijay, MBBS MD Pharmacology, and this is the Audio Hub to make the best simplified basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal and clear. If you really find, and if there's a question hovering in your minds, is pharmacology difficult? Lend me your ears for a while and let in the magic of knowledge. The wonderful after vacay topic is adverse effects to be taken care of while the treatment with the beta blocker drugs. First and foremost, let's discuss the lung side effects. They are very easy to understand. Beta blockers block the beta 2 receptors which cause the spasm in the bronchi. That is a danger and threat to the patients of bronchial spasm conditions like asthma, COPD, etc. So, it's well understood that beta 1 selective antagonists, they are a boon in the states of COPD and also cardiovascular pathologies. Now let's talk about the central nervous system side effects. The beta blockers, here they show signs and symptoms of tiredness, sleep pattern disturbances, and also sometimes depression. These findings, they are not much supported by clinical evidences, but they are commonly reported. Let's talk cardiovascular adverse drug reactions. In the congestive heart failure, beta 1 selective drug metoprolol and non-selective drug like carvedilol, they are quite safe than the other beta blockers. Bradycardia also occurs, and it's a great threat when co-administered with the drugs for the sick sinus syndrome, properties like verapamil, etc. If the subject is suffering from peripheral vascular disease or Raynaud's syndrome, then that condition may worsen. If the beta blockers, they are suddenly stopped after a long time therapy, then that may precipitate angina or ischemic heart problems, and sometimes it can be fatal also. You can very well understand the reason, that is simple increased sensitivity of the beta receptors. The dose of the beta receptors in such a case, it should be tapered down slowly. A very good raison d'etre is upregulation of beta receptors and downregulation of the GPCR kinases. As far as the metabolism is concerned, beta blockers, they mask the signs and symptoms of hypoglycemia, and the recovery from the hypoglycemia is also much delayed. That is how they pose a great caution and threat in the diabetic individuals. Caution is also for the use in pregnant females. And also there is a rare reporting of sexual dysfunction in hypertensive subjects. Those are having high blood pressure. What should we know about the overdosage or the toxic states of beta blockers? These are simple extensions of the pharmacological activities like bradycardia, hypotension, increased atrioventricular conduction, seizures, depression, etc. Hypoglycemia, bronchospasm, they are already narrated threats. The treatment options for the toxic states, they are atropine for bradycardia, cardiac pacemaker can be used, hypertension can be treated with sympathetic drugs like adrenaline or noradrenaline. Glucagon also helps by showing positive chronotropic and inotropic effects. That's all a great big account of the adverse drug reactions that are seen and that should be actually noted down, that may pose great threat and caution in individuals. Now let's talk about the drug interactions. Some important drug interactions related to beta blockers, they are first, Cholestyramine, cholesterol group of drugs, they decrease the beta blocker absorption. Simple, by forming complexes. Second, drug inducers like phenytoin, smoking, rifampin, etc. They actually enhance the metabolism and decrease the effect as well as the plasma concentration of the beta blockers. Third important drug interaction, the hepatic blood flow is influenced by drugs like hydralazine and cimetidine. And how these drugs affect? They enhance the bioavailability of beta blockers. Next important point, beta blockers, they impair the clearance of lidocaine or lignocaine, whatever you call it. And lastly, beta blockers may show additive effects with antihypertensive agents. That's all for the day, folks. Let's pause here to talk more the next time. I'm sure it's gonna be very soon the next time. For all the updates and latest episodes of my podcast, please visit www.ispharmacologydifficult.com, where you can also sign up for a free monthly e-newsletter of mine. It actually contains a lot of updates about medical sciences, drug information updates, and my podcast updates also. You can follow me on different social media handles like Twitter, Insta, Facebook, and LinkedIn. They all are with the same name as Pharmacology Difficult. If you're listening for the first time, do subscribe and follow whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes, Apple Podcast. Stay safe, stay happy, stay enlightened. Thank you.